this year.
Thanks, Steph, and thank you to Representative Rabb and Nikki. You know, I wholeheartedly agree with everything you said, and thank you for all of your nice words. I'm Abby Raudebush. I'm the Director of Government Affairs here at Americans for Safe Access. As Steph said, I will do a dive into some of the data and takeaways from the report. I know it's a big report and was just sent to you, so hopefully this will be helpful as you are diving into it. This report has been published in different variations since 2014. We do look at every state and US territory. Our rubric is based on the full array of patient rights. We ideally would like someone to look at the rubric and include all of those provisions in their medical cannabis law. And when all those provisions are there and working together, then we consider that an ideal law from a patient's perspective. We do have gold standard states in the report. So those states are the states that scored the highest in a given category. But it's important to note that we are not saying that that state is perfect or ideal in that category. It's simply the highest scoring state for this year. You'll see when we get to it that I think the gold standard in only one category received 100%. So most of our gold standard states could really still improve in those categories, even though they were the highest ranking in that category this year. For each state and territory on the individual report cards, we do provide an overview and recommendations to the state program so legislators can have a better idea of maybe what they should focus on or put their priority on first. This year, we graded each state and jurisdiction on over 120 subcategories. There are 6 core categories, and then there are 120 metrics among those 6 categories and a 7th penalties category. This report is updated yearly. So this report analyzes and grades every law that was in effect by December 31st, 2021. So anything that went into effect January 1st, 2022 or later will not be reflected until next year's report. And then off to the right side, I put our grading key just so you can sort of have that to frame the conversation going forward. This isn't an academic grading scale. This is more of a curved scale. It's one recognizing that there is just such a difference in all 55 states and territories that we graded that, you know, on an academic grading scale, I think some states like Oregon would have ended up with close to the same letter grade as somewhere like Idaho that has a total prohibition. So our grading scale is a little different from an academic one. The core categories in this year's report card, we have patient rights and civil protections, access to medicine, program functionality, affordability, which is new this year, and health and social equity, which is also new this year. And then we also grade on consumer protection and product safety. That category is worth 200 points, but the rest of the categories are worth 100 overall. And then we also have a penalties category. This is for policies in states that actively harm patients. There are a number of them, which we'll get to in a little bit. So you can see what kind of policies we're talking about. They include things like limiting or prohibiting THC or CBD. So it wasn't enough that states just didn't receive points in those categories. Because they actively harm patients, we deducted scores in this category. Excuse me. Some top line data. Maine which received a B, is our highest scoring state this year with a 76.14. So you can see that even though it is the highest scoring state, Maine does have considerable improvements to make. But overall, despite having a 76.14, Maine does serve patients best among all the states and territories. And then our two lowest scoring states are Idaho and Nebraska. Of course, both of those still have a total prohibition on cannabis. They do not allow medical cannabis at all. So those are the other end of the spectrum with the lowest scoring states. Overall, the average score across the country, the average grade was a D. So I know it's easy to think, I fall into this pattern sometimes, like, wow, we have come a long way because so many states have passed medical cannabis, and we have come a long way. But this just shows that the journey is it's only just begun. There's still a lot of work to do besides just passing a medical cannabis program. Here you can get an overview of what all the states' grades look like. There's the distribution chart off to the side. I'll also have this slide at the end, so you'll have another chance to look at it. The gold states are states that have CBD only medical cannabis laws. The purple states have a medical cannabis program, and the blue states have both medical cannabis and adult use. So now we'll get into each category. I want to let you guys know what the highest scoring state is and what the average. For each of these different grading metrics, arrest protection, affirmative defense, you can find more information about what we graded, how we evaluated this, why it's important. You can find that at safeaccessnow.org/rubric. For each grading category, we went through and told you what we're looking for, how we graded it, and all of that. So that link will have a lot of detailed information for you. For civil rights and patient protections, I was happy to see that Delaware, Illinois, Minnesota, South Dakota, and the US Virgin Islands, they all tied as our gold standards this year with a 90%. I believe in this category, most of the states were missing parental rights protection. So in those states, your status as a medical cannabis patient or your actions as a medical cannabis patient, so actually medicating, can be used against you in family court in cases of child custody. So I believe that's where most of those gold standards lost their points. The average score for this category was a 57.47, which is really disheartening to see, because the very, very minimum thing a state can do when they allow access to medical cannabis is to ensure that these patients are actually protected under the law as patients. And so it is disheartening to see that overall as a country, you know, we're really falling behind on that aspect. Then when we look at access to medicine, Maine, our gold standard state, and also our top scoring state this year, received a 95%. This category, again, average across the country, very low with only 39.47%. What we find here is there are a lot of states that just do not have a sufficient number of retail licenses when you consider the size and population of the state. Many states also do not allow personal cultivation, which is very important to patients, not only in terms of access to medicine actually having a reliable supply, something that they can control. But this also goes toward affordability as well. It is more affordable to patients when they are able to grow themselves instead of necessarily having to buy from a retail location. And then also a surprising number of states do not offer reciprocity or at least full reciprocity to medical cannabis patients across the country. Some states do, others require patients to register and pay a registration fee as a visiting patient. This is just another burden that is placed on patients. And as Nikki mentioned earlier, access to medicine is very important, just like any other medication. Just because you're traveling somewhere doesn't mean that you don't need that medication anymore. So for medical cannabis patients, they have to worry about things like reciprocity on top of, am I going to get arrested if I travel to the state, but can I actually access my medication legally there? And if so, how and why? What hoops do I have to jump through? How much more is this going to cost me? Things like that. Next, we looked at program functionality. Maine is our gold standard state again, with the 100%. This really looks at the administrative and the state side of the program. How does it work on the back end of what they're allowed to do? Average score across the country, this is one of the highest average scores with a 60.84. Something that I want to point out here is reasonable purchase limits. We do see a lot of states, there is a overall limit for how much you can purchase a month, but the individual purchase limit, what you can buy at one time in a retail location, is not equivalent to the monthly allowance of cannabis. And that's something that states should really fix. Just like, if you go to a pharmacy and you pick up your medication, you're not expected to show up there once a week and buy 7 pills and then show up the next week and buy more. You can buy a month at a time. And it just like you use medication from a pharmacy, cannabis patients use cannabis and cannabis products from dispensaries. And so it's important to understand the kind of burden that you put on patients when you have the disconnect between monthly allowance and purchase limits. Affordability. This is something year in and year out we hear from cannabis patients. It's something that I hear definitely most often when patients talk about the burden of this program. And it's important to note that we're not only talking about the cost of products themselves, but we're talking about paying for a special doctor's visit to get certified, paying registration fees every year. In some states, those registration fees can go up to $200. In some cases, caregivers also have to pay for background checks, and then the sales tax on top of that as well. It's important to remember that unlike any other medication, this medical cannabis is totally out of pocket. Every financial transaction that goes in from the beginning of paying a doctor for this visit to the registration fees, everything is just an added burden on the patient. And all of that happens before they're even allowed access to a retailer to then begin buying these products, which are also expensive for patients to use. So they have an administrative financial burden that they have to overcome before they can even access their treatment option. This was definitely our lowest overall category. Illinois is the gold standard state, but only received a 65% in this category. And overall across the country, it was a 39.69% average, which really just highlights, I've never once doubted anything any of our patients have told us, but this just highlights what a big problem it is. And I think it also will highlight to lawmakers real things they can do to help alleviate these financial burdens from patients. Because I think a lot of times when lawmakers hear, the medical cannabis program is not affordable, they think only product cost. And they think, well, I can't really do anything about that. But there are a number of things here that they can do to help alleviate that financial burden from patients. And then we look at health and social equity. Ohio was the gold standard state with 90%. The average score across the country is a 45.20%. Some things that are really important, all of these things are really important, but just to highlight for you right now, there are a lot of states missing housing protections. Some of them only goes so far to prohibit a landlord from discriminating against someone for their status as a patient, but some states allow landlords to discriminate against patients just by being a patient, allow them to limit the kind of actions that patients can conduct in their rented dwellings, which really impacts patients. It's harmful, it's discrimination against patients for their treatment options, but it also harms them because it prevents them from being able to medicate or puts them in jeopardy of being evicted, removed from their housing. Access to minors is another big one. It's very important that minors have access to medical cannabis. And it's also important that states and legislators do not put arbitrary burdens on minor patients. There are some states that require a second or third opinion before a minor can be certified for medical cannabis, when adults in that state only need one opinion from a primary doctor to become certified. And then also ensuring that there is access in underserved areas. So in another category, we talked about having a sufficient number of retailers. In that, we looked at the ratio number of retailers to medical cannabis patients. But in this access in underserved areas, it's less about the number of dispensaries in the state and more about where they are located. So making sure that patients all across the state, no matter where they live, have the same access to medical cannabis, making sure that cannabis patients in a city aren't the only people across the state who have access, or don't have to drive 3 or 4 hours just to get to a retail facility. So for consumer protection and product safety, this one is a big category. Like I said at the beginning, this one was worth 200 points, while the other categories were just worth 100. So for this, we really break it down. It's seed to sale to testing, from cultivation, manufacturing, the dispensary operations, and the lab operations. We look at all kinds of testing and training requirements within these categories. So we want to make sure from seed to purchase that the state is aware of what it's testing, that the products that consumers are getting are safe, that the labeling is accurate. So that's why this one's worth more points, because consumer protection and product safety is a big, broad category, and one that is very important because we need to make sure that what patients are getting are safe and reliable. Nevada is the gold standard state for this category, and the average across the country was a 40.75. This category is one in which a lot of states didn't get as many points as they should have, had some pretty low scores that brought down their overall grade. So states should also be looking at all these consumer protection and product safety this rubric and see things that they can improve, so patients can get something that is safe. And then for our penalties category, this is where we deducted points from states. If a state gives regulatory preference to adult use, they were docked 20 points. I want to be clear here that we are not trying to discourage passing adult use laws. We're not in opposition of adult use laws, but it's very important to be aware that adult use laws are separate from medical cannabis laws. The two programs can coexist in a state, but one is not a replacement for the other, and they do need to remain separate. In the medical cannabis program, you have very real patients who rely on medical cannabis and receive very real benefits for their very real conditions. And it's not enough to just say like, oh, well, we opened a recreational dispensary, so you can go there. It's not the same. The medical cannabis program also contains those important patient protections that don't show up in adult use laws as well. So if if states give regulatory preference to adult use, or in other words, pass adult use and then completely ignore or roll back parts of the medical cannabis program, they were docked points. Other things to look at here is if there's no system for adding qualified conditions, or if cannabis is listed as a medicine of last resort. Both of those things harm patients and prevent access to medical cannabis. And really 25 years of medical cannabis advocacy and learning from other states, there is no state that should be classifying cannabis as medicine of last resort, and certainly no state that should have no system for adding qualified conditions. That's just unacceptable for patients, and really makes it hard for the state to make any big improvements if they can't even do those things. Quickly, I just want to go over some key takeaways. Most medical cannabis programs throughout the United States are growing. So this is good news. They are accepting more patients, that the program is working, at least in part, for a lot of patients. We've seen that small improvements can make a big difference for patients. At the beginning of the COVID-19 pandemic, at the beginning of 2020, ASA was critical in ensuring that states classified the medical cannabis program and medical cannabis dispensaries as essential businesses. And along with that, many states allowed things for the first time, like curbside pickup, telemedicine for certification and recertification, and delivery of medical cannabis. And what we have seen since then is that many states have kept those provisions in place because they saw what a difference it made for patients. So even things like that can be made, that may look like small improvements to the state, things that can be done quickly, really can make all the difference for patients. Again, the cost of medication is a huge barrier. It's something we hear from patients all the time. It's something that's reflected in our report, and is something that lawmakers should keep in mind. Not only the cost of medicine at these retailers, but all the other costs associated with being a patient as well. No state is perfect. Just because a state has passed a medical cannabis program does not mean that their job is done. And there are a lot of improvements that every state, even Maine, the top scoring state this year, can make to improve the lives of patients in their state. And then finally, an absence of national coordination really does harm patients. You'll see when you look through the report that there are no two states that look the same when you look through their report card and their grade. Everything is done differently in states, from how patients purchase medication to who can become a patient, to how easy it is to access things, even how easy it is to access information on the state's website. And because there is such a difference across the United States, it makes it difficult for patients to know what they can and cannot do, where they can travel, where they can medicate. So this report really highlights that we do need national coordination to set the floor, set the limit for these are the protections that you must provide for patients. And ideally, the floor is our rubric that includes all of those basic rights for patients, but still allowing the states this ability to plan their programs and tailor their programs to the state. So certainly states can go above and beyond our rubric, and I would love to issue that challenge to all of them. And then one more thing I want to touch on is just making sure that no patient is left behind. Again, I want to reiterate that recreational adult use laws are no replacement for a medical cannabis program. Both of these can coexist, but these patients need the protections and benefits that only a medical program can provide. Again, these things like housing protections, employment protections, DUI protections, parental custody, things like affordability. It is critical to make sure that medical cannabis is affordable to these patients who rely on it for their health needs and can't decide, well, I don't have the money right now, so I just won't get it. That's not a luxury that patients have. It's important that people do not read into lower enrollment numbers in recreational cannabis states. I know that there is a gut reaction sometimes to look at lower enrollment numbers and just say, see, I knew it. The medical cannabis program was just a cover for people using cannabis recreationally. And because we don't have, or because we have recreational cannabis now, those people don't need to be patients anymore. I don't think that's what people should be reading into these numbers. I think it's very important to remember that recreational adult use programs do not have the administrative financial burdens attached to them that the medical side does, and that patients are, they're trying to do what they believe is easiest for them and what costs them less amount of money, but that can be dangerous for patients if we send them to the to the recreational side. So we need to maintain the medical program. It needs to be maintained and improved while they're doing recreational adult use. So states, it's just very important for states and lawmakers and people who think about this policy not to confuse or get distracted by the bright light of adult use and forget about the very real patients who rely on the medical cannabis program. Okay, and then that is my spiel, and we can take questions now. And here is this map that I promised again, so you guys can see the grades across the country.
Great, thank you so much, Abby. That was a great overview and just a reminder of how much work there is to do. I think one of the challenges that we see as patient advocates is that because the news is full of stories of this big industry that was created, that people think that the fight for medical cannabis is over. And I think this report definitely underlines the amount of work we still all have to do.